Yeah, thank you very much for giving this opportunity. So we have again paucity of time, no problem. It is the thing is, she is blood flow restricted training. The thing is, this is such a new concept which are coming up, and this is a practical subject. So theoretical is very difficult, but I will try to demonstrate also something so that take-home message should be there. So I am Dr. Hanjabam Barun Sharma, sports and exercise medicine as well as clinical physiologist. So I will be talking something about interventional physiology, where we have to apply the principle of the sports science and physiology into your practice, that is exercise prescription. So blood flow restricted training. So before going into the blood flow restricted training, I will be something focusing on the fitness part. Why this is important? National player, so you have to apply whatever you read on your ground. That's more important. Then going on different this thing, what you call exercise prescription is Dr. Kiran will be having in detail. So one has to understand, there are the different principle of the exercise training, like sporty. You just have to remember the fit principle, and depending upon the different component, you have to understand which exercise to be given in which clinical condition, or which which goal, like performance enhancement, or it may be weight reduction or something like that. So that's important. So before going into the detail, you have to understand the basic physiology, because everything comes to the basic science. Whatever you are having is thus intervention of the science. So this is Hanjabam principle. Everyone must be knowing. That is the Hanjabam. It was the the principle of the orderly recruitment. That is what is happening is there are different type of the fibers principle is there. When you increase the load, then there will be what will happen? That is incremental increases happen. That is ultimately it will go into the what you call type 2 fiber, what is known as. The type 2 fiber is especially important for what? Production of force. Production of the whatever the more force and everything, that is type 2 fiber, and type 1 is basically for oxygen. That means if you want to build your muscle, then, and if you want to have a strength, then which component you have to focus? Type 2 fiber. But the problem of the type 2 fiber is what? The training has to be done at a higher RM, repetition maximum. ज़्यादा करना पड़ेगा, weight ज़्यादा उठाना पड़ेगा, you have to. So what is the problem with that? You cannot prescribe that type of exercise to elderly person. You cannot prescribe that type of exercise to one who is having just after say TKR or ACL reconstruction or something like that. So that constraint is there. So if you know the physiology, you can modify it in order to use that. That is the importance of understanding the basic science. Another important is if you see the EMG. EMG is also coming up. Every sports physician has to know certain physiological technique like EMG and HRV and all these things. Is absolutely important. So what is important is if you see this is the human body biomechanics, you must be understanding everything is angular motion. So what is important is if you increase the tension at the same tension, if you want to increase the fiber recruitment, you have to increase the angular velocity. That means speed of the contraction. So one thing is what? You have to increase the training load in order to focus on the type 2 fiber, which is important for your strength. Another is if in the same load, if you do a more speed, then what will happen? Your recruitment pattern will increase. So these are the basic physiological concepts. So let's see how we have to apply that. Then we already know that another interventional physiology is importance of the eccentric training. Everyone knows that eccentric training has more mechanical tension. Mechanical tension is important for the muscle hypertrophy, muscle build-up. And if you see many papers as published, even in the elderly population also, there is tremendous importance of the eccentric training. But there are side effects also, like DOMS is more present in eccentric training. There is always risk of the injury is there. And if you see the plyometric, the eccentric training is an essential component of the stress shortening cycle. So what is important is, but if you understand the concept of this eccentric training, where this is the basic stuff, just if you understand the force velocity curve, what is happening is if you see the EMG pattern, and when you see the concentric and eccentric part of the isotonic contraction, what is important in the surface EMG, if you see what is happening at the same load, there is reduction in the recruitment of the fiber, which we don't want. So usually what is happening if you do training, if you prescribe the training, when it is coming down, that is happening the eccentric training of the quadriceps. So in the eccentric training of the quadricep, since the EMG recruitment, that is, muscle firing will decrease, that means you will not achieve that stuff. So what you have to do, just increase the load in the eccentric part in order to focus that component. So this is the importance of knowing physiology. This is the importance of the basic concept where you have to apply. So the advancement of this research has been incorporated by, Technogym and all this stuff. They are coming up with different design where different resistant training protocol they have add, and they just have to add 1.5 load in the eccentric component. So why I am saying all this thing? Because blood flow restriction training is also just a apply of physiology. That's all. Interventional physiology. This was the graph which we obtained. What is happening is, if you just see, yesterday we saw all this thing in the ADI instrument. So these were recorded by using the ADI. If you see just the what you call the row EMG interference pattern, and when fatigue is there, then what is happening to the firing? The firing increase. The firing of the muscle fiber increase in case of the fatigue. Fatigue, RMS, root mean value is increased, the mean power and frequency is basically decreased. So what is happening is, if fatigue is there, then what will happen? You can focus on the type 2 fiber. Type 1 fiber will be there. And what you want for the strength and the muscle hypertrophy? Type 2 fiber. So if you can do, by manipulating something, if you can bring the fatigue earlier, then you don't have to do 65% of RM in order to get the type 2 fiber. So that is the principle of the blood flow restriction training, where we basically, tie a cuff, and what is happening is, you are artificially inducing the earlier fatigue by just restricting the flow, venous flow from outside. Because if venous flow is from outside will be restricted, then what will happen? All the muscle metabolite will be accumulated, and that muscle metabolite, you will artificially induce that particular fatigue, and what your body doesn't understand, your brain doesn't understand that. And then what will happen? Your type 2 fiber will come into the play, and type 2 fiber is what we want if you want to do muscle hypertrophy and muscle strength. So that is the beauty of the blood flow restriction training. Without doing excessive load, you are getting the benefit just by manipulating your environment, just by manipulating your physiology. So this is basically, the training where orderly recruitment is there, and just by adding the blood flow, you are manipulating stuff. You are just, you're confusing your brain. So venous occlusion is there. In this way, we can easily do the blood flow restriction training, which is extremely important for elderly people also. Because after 30 years, what has happened? Sarcopenia will happen. Obesity, sarcopenic obesity will happen. And lean muscle mass is extremely important for anything. For all-cause mortality, for diabetes, everything. So that's why, but the problem is, these guys, they cannot do up to 65% of the 1 RM. That will be difficult. So just do the blood flow restriction training, and you can incorporate that. And the mechanism, I am not going into the detail of the mechanism because of the paucity of time, but what is important, 2 things, extremely important. In order, if you know the basic, this mechanism, if you want to target 2 things, mechanical tension, metabolic tension. Mechanical tension and metabolic tension is important for muscle hypertrophy. So what is happening is, the combination of the body you have to supply. The mechanical tension, what mechanical tension you can use, you can increase the load, but the problem of the load, I have already explained you cannot apply to some patient or some people or some player is there. So in that case, you can increase the metabolic tension by applying blood flow restriction training, and these are the different, biochemical stuff, because everything, when you come down to the cellular level, they doesn't understand anything, only chemistry, biochemistry is the key. So by just understanding the recruitment of the mechanotransduction and muscle, minute muscle damage is also important. Then what will happen? Satellite cell will come into the play, and satellite cell is the one which is important for your muscle hypertrophy. So this you have to understand, and different mechanism are there, or this lead to the what you call, and it has been evidence. The evidence is so profound, so profound. If you see, this is the graph which you see this side. So what is happening is, if you see the torque is the angular force, nothing. So high training, after just giving the high training, this is post training, then your torque will increase. Obvious. This is very obvious. Then if you do if you give the training at a very low intensity with occlusion, the torque will also increase. That means you are getting the benefit of high training without doing any training. So that is the important. So as compared to no training at all or low training without any occlusion, you are achieving, the concept. And this technique was actually, present in Japan, but they have just published this paper for the first time in 2000. This technique has come only in 2000. So in the same way, just by doing different manipulation, by just having 30 to 40% of the RM, by using what you call the blood flow, you have the comparable result to what? High training. Instead of the decreasing the risks of the injury, you can just get the benefit which you are getting in high intensity. That is the beauty.
Excuse me, Dr. Barun.
Yes, sir.
Please wind up.
Time, sir? Okay.
Yeah.
So, I will not go further. So, there are different things. And one point which I want to say is, one thing is there, in blood flow restriction, systemic effect is also there. So, if you are having, training there, you can have, the growth hormone and other, anabolic hormone is present, which can affect the muscle everywhere. That means it is not just like that you are restricting somewhere that there has a local effect. The systemic effect is also there. So, I will just demonstrate some of the point. Let me check. Please come. Please come. So, the problem which we are facing is we don't have expertise in ultrasound, Doppler ultrasound. So you must be knowing this guy. They are doing blood flow restriction. There are so many different protocols. So I am not going to the detail. So basically, what you can use, this is as a surface ultrasound. So that pressure is the arterial occlusion pressure. This is entirely a workshop practical topic. So we will take in later on. But the important which I want to say that why this is important to have. No problem. So what is important is, just by knowing that occlusion pressure, you can prescribe the exercise like in 2021, they have published this paper, like the protocol is there. So in that particular protocol, what you can understand is, therefore upper limb training and lower limb training, they can give 50% of the occlusion. So you have to know the occlusion pressure, then only you are able to prescribe the exercise. So that's why occlusion pressure knowledge is extremely important. In the same way, one thing is also important. Even if you don't do any exercise also, since growth hormone was released, the preservation of the muscle atrophy, prevention of the muscle atrophy is important. So if you do the occlusion without giving an exercise, just before the surgery and just after the surgery, so you can reduce that muscle atrophy because of the disuse. So that's important. Thank you very much, sir, for to be liberal with me and giving 2-3 minutes extra. Thank you very much, sir. Circadian rhythm has to be taken into consideration for training. Circadian rhythm is extremely important. Chronotype has a influence on the HRV, right? But per se, on chronotype, research are very limited, sir. Not much research has been done, but chronotype has an important role on performance. And most of the study has indicated that the player performs better in evening hours. If you neglect the chronotype as such. But chronotyping has to be done for a particular player. Some players are the morning type, some players are the evening type. So depending upon their chronotype, we have to adjust their training and that stuff. For HRV, for that HRV, no such pure research based upon that chronotype is not yet done. It has to be done. Like for example, HRV during the sleep. We want, like Dr. Deepak has just said, it has to be stationary. And the body is perfectly stationary when slow wave sleep is there, in deep sleep. That's why HRV monitoring during the deep sleep has becoming extremely important nowadays for players also monitoring also. Otherwise, what we do is, when the player comes, we generally do the monitoring in the morning itself. Morning mein monitoring karte hain, and depending upon that the value, we give the training load. Training load uski hisab se dete hain. So, not much time is there to play the slide. I was just two point slide. I have not met the slide for this one because I thought that Dr. Gagan will take care. So point to point discussion, let's do it. Dr. Guru, please ask me some question, yaar. Kya? Please ask me some थोड़ा tough type का पूछो. Absolutely, yeah. Absolutely. Yeah. See, the minimum duration, it depends upon the different factor, but there is task force is there, which you must be knowing, ultra short, and the short term is there. Ultra short is less than 1 minute. In less than 1 minute, you can say the autonomic tone approximately, ultra short. And other to standard to 5 to 10 minutes is good enough. And regarding the intra, what you call, so let's, I will just jump to this. Oh, see, intra exercise heart rate something, what you are asking. Suppose, yeah, pointed. See, HRV can be measured during the exercise also, but there are certain factors which are important. Like Dr. Deepak has already told that stationary kab hoga when there is when you have that particular phase. That means 5 to 10 minutes at the same load you have to give exercise. You cannot do incremental exercise and you cannot measure HRV. So what we can do, this is just basic physiology. These are the cardiorespiratory testing. What ये सब हम है. So what is important is you have to know certain point. Like number one, there is known as VT, ventilatory threshold 1 or anaerobic threshold. And there is something known as respiratory compensation point. So what is the difference between that? Your respiratory system in compensating and your basically your end tidal carbon dioxide is relatively same between that. So why this is important? This is important because HRV you can use only up to this point, up to this. That means anaerobic threshold. Beyond that, what? Respiratory compensation. Your respiratory system will come into play. Lactic acid इतना build up हो जाएगा. Hydrogen ion will build up such like that. Your respiratory center will be stimulated like crazy. Then what will happen? Carbon dioxide wash out and heavy breathing. And breathing क्या influence करता है? Heart rate को. So you cannot measure HRV. HRV has a limitation here. You cannot do exercise HRV in that point. So what you have to do? You can do HRV only and only up to this point. That is क्या? Moderate intensity से कम. उससे ज़्यादा नहीं कर सकते. So that is a limitation. So what we do generally is before exercise के पहले, that is resting HRV is the most important point as compared to the exercise HRV. And post exercise HRV also you can do. देखते हैं इसमें क्या क्या slide है. So let's see one point where Dr. Gagan was saying about a Valsalva manure का भाई what is the practical use? जब तक practical use नहीं आएगा तो ये सब तो भूल जाएंगे. हाँ, that's right, sir. Absolutely important. मगर slide कहाँ गया? I have to see. I have put one slide in this thing, weightlifting वाला. So what is happening is आपके weight lifting करते समय breathing technique is extremely important. Valsalva maneuver is a double-edged sword. आप क्या करेंगे? If you hold breath like anything, and if you lift heavy weight, then what will happen? Sometimes fainting will happen, projectile vomiting will happen. And अगर आप ज़्यादा नहीं करेंगे तो spinal bracing will not happen, spinal injury. So you have to balance between that. तो coaches पूछते हैं कि डॉक्टर साहब कितना करना चाहिए, क्या करना चाहिए? तो in that case, you can see, मैं यहाँ पे picture डाला था. Let me check. It's not there. Okay, no problem. Acha, okay. I'm doing the wrong one. Actually, I have not met slide, that's why that is the problem. So the thing is, so in case of the weightlifting, what normally the coaches used to prescribe it, you just try to breathe as if you are going underground. जैसे कि आपके गर्दन तक पानी है, suppose water is up to neck, then क्या करोगे water? You have to inhale and then go down. थोड़ा सा breath hold करना है, then bracing of the spine is important because spinal support you have to go, then you have to go up. This is all slide actually. So these are the HRV thing, why HRV is important. Suppose you don't have VO2 max. Suppose you don't have VO2 max. VO2 max के लिए क्या है? You require a very big instrument, 35 lakhs, gas analyzer. Or you can do like, but you have a HRV. There is a direct correlation between VO2 max and HRV. See, this is the actual laboratory data which I perform. Regression equation is there. So you can measure VO2 max from HRV. So that is also important. So all this thing, ये change नहीं हो रहा है क्या? So and percentage body fat also it's important, and so let me show something. This concussion also now coming up like anything. HRV is one of the important this thing in concussion. Concussion is heavily dependent on different pattern because heart-brain autonomic axis is there. So in that case, HRV will play an important role in because you can certify the particular player to whether they are fit for returning to play or not. So not only on the neurochemistry. So and also there is something known as alpha training, ECG, correlation of the ECG with HRV. Like for example, slow breathing. If you do the slow breathing, then what will happen? Your parasympathetic activity will come into the play. That means your player is doing relaxation. And if you do the EEG, then what will happen? Alpha wave will come. Alpha wave. Alpha wave is something when you are relaxed. So you can do what is known as a biofeedback. This is very important in case of the sports psychology. Sports, what is centering and self-talking, your diaphragmatic breathing. What is the basic physiology? HRV, autonomic function. You are just manipulating the autonomic function by breathing technique. That's all. When the yogis do, when they are decreasing the heart rate, how they are doing? They are just manipulating by using the breathing. Why? Breathing has directly connected with this thing, cardiovascular center. So there is, if you know the basic physiology, you can always manipulate. And you can manipulate in your favor. Ultimately, what we have to do, we have to stress the physiological limit so that performance is there without doping. Just like what I told you. Athlete may be fit, but they are not able to stand. This is one of the problem, paradoxical. Fitness induced postural hypotension. Why? Vagal overload is there. बहुत ज़्यादा वेगल ओवरलोड हो जाएगा तो क्या होगा? Like Dr. Gagan was saying, when somebody just stand up, venous pulling is there, नीचे में चला जाता है, cardiac output will fall, फटाक से बेहोश हो जाएगा. This is actually common among players. अब ये नहीं है तो क्या होगा? Sometimes what is known as POTS, POTS, postural tachycardia, orthostatic tachycardia syndrome. ये COVID के बाद it is one of the most commonest syndrome which we are having. The player or the particular person will not fall, but tachycardia, heart rate will rise like anything, especially after the COVID. This I have seen in so many cases in COVID. Like sir is saying, weightlifting, intra-abdominal and intra-thoracic pressure, extremely important. That is the role played by your belt. Your belt is actually acting that thing. But the problem is, this has happened. But the problem is like Dr. Gagan was saying, like Valsalva, whenever he was saying different this thing, the phase 1, phase 2 में ये होता है, भाई what is the clinical importance of that? That is important. This is the clinical importance. अब देखो फेंटिंग में happen, देखो क्या हो रहा है यहाँ पे, BP will drop, blood pressure drop हो गई, brain में it's require, blood will not get, then what will happen? पटाक से fall. Then another is what will happen if you have too much, Valsalva means what? You are holding breath with the closed this thing. Then what will happen? You will compress your abdomen. Projectile vomiting will happen. Bleeding will come also. So all these things you have to, if you know the basic physiology, you know how to manage also. So that's why the knowledge of the basic science is important.
This is one of the reasons that weightlifters, they do very frequent strength training, but they are not analyzed on this as an aerobic and this light part of it.
That's right, that's right.
They lack this training and sometimes exercise is killing them.
That's right. Absolutely important. Monitoring के लिए heart rate use करते हैं, heart rate variability. Heart rate is also important. Heart rate कैसे use करते हैं? Just remember 57, 64, 76, 96, 96. बस maximum heart rate हम ऐसे याद करते हैं. You prescribe the exercise based upon that, very light, moderate, vigorous, and near maximum. Less than 57 of maximum heart rate is your this thing. So depending, heart rate monitoring is extremely important and it's easiest thing. So when something which does not cost much and when it is easily available, so why not to use? And it require a minimum physiology. Minimum. So this is a tool which a sports medicine physician can add, and this is something which you can add and you can beautifully excel. Please. Yeah, they see, there is something known as interference effect. When training is come, everything is biochemistry and physiology. Strength training is done by mTOR pathway. I am talking about biochemistry. Endurance training is done by M ke pathway, AMP ke pathway. The problem is, if you go into the biochemistry, when you do endurance training, they have some negative effect on the strength side. So what is happening is, if your aim is to increase performance in power, if you do too much aerobic exercise, then what will happen? Your performance will not be there. So that is known as interference effect. So how you are going to manage interference effect? By, if you can do concurrent training, that is known as concurrent. When we are doing combining different type of the training, that is aerobic training and strength training, that is known as concurrent training. So concurrent training has a different goal. Like suppose if you want to improve the performance, definitely you can add strength training, because mTOR pathway has no negative effect on the endurance. No problem. आप strength training करो, कोई दिक्कत नहीं है, performance अच्छा रहेगा. मगर if your aim is to increase the power, weightlifting करोगे, तो then you have to limit your endurance training. और कौन सा type of endurance training करना चाहिए? High intensity cycling. Why? Because high intensity cycling has a minimum negative effect on the mTOR pathway. These are the basic biochemistry. So like for example, what you are asking in a doping thing, steroid क्यों नहीं देना चाहिए? The basic mechanism of steroid is anti-inflammatory. That will cause the problem in PRP, especially leukocyte PRP. The purpose of the leukocyte is to increase the inflammation, so the healing happens. If you COX-2 inhibitor, then what will happen? Hoga hi nahi. That's why it is not combined. So my purpose is, if you know the basic idea, yes, of basic physiology, basic biochemistry, then what will happen? Your clinical knowledge will improve like anything. And if you know the basics, you can manipulate it. And the purpose is just to improve the performance, that's all. Or kuch question?
Concussion, is there any study that tells that measuring HRV can prevent concussion? Or
See,
certain type of training that can influence HRV can, like what we have read the RTP protocol, they say that first immediately rest, then add a little cycling or something to increase the HRV.
Absolutely. See. Preventing concussion is a good this thing. People are coming up like anything, like neck strengthening of the neck muscles is also coming up. Recently, someone has the collar thing, Q collar. Q collar, Dr. Ashe has posted. What was the importance of that concept? That is something known as Monroe-Kelly doctrine. If you have read in physiology first year, it is a short note question. What is important? If you see, our head is a fix; it cannot expand. Whatever inside, if you increase one pressure, then you have to decrease another pressure. So by slightly compressing your jugular vein, what you are doing? You are preventing the outflow of the blood from your cranium. Then what will happen? Your back pressure will be there, and slight increase in back pressure kya hoga? Because brain, the concussion is basically what is happening is, kahan gaya brain? Isme thara picture. So what is happening is your brain is freely floating like anything. Counter cup and cup wala. So just let me show see. So your brain is freely floating. And now suppose if you build up the pressure surrounding the brain, then what will happen? That vibrating impact will not be there, na? That means theoretically concussion will be reduced. So research are going on, people are doing research. That's why Q collar and all that stuff is, like for example, Dr. Kiran was saying about doping. There is something not a neurodoping. In neurodoping, what we do is we just stimulate your brain area by external electrode. Ultimately, your muscular system has to perform where it is coming the signal, motor cortex. Suppose, and motor cortex कैसा आ रहा है? Electrical signal. अगर मैं बाहर से electrical signal दे दूं, suppose if I do electrical signal from outside, then what will happen? You will prime that pathway. Performance has to increase. Now there's commercially available instrument idea that is known as neurodoping. It has been now considering that whether it should be included in doping or not. So like that, so these are the basic stuff which can be used by you and or any sports scientist. So that, like for example, HRV. HRV cannot, preventing by using HRV is difficult, but HRV you can always use to judge whether, what type of the rehabilitation program you have to give. Suppose your player is already in a vagal endurance, highly trained endurance player, his or her blood volume is very high, suppose. And if you are giving that endurance training you are giving, then what will a postural hypotension will be increased. So by knowing, by doing the HRV, you can modify your exercise prescription also. कौन से player में कौन से, or simple, for example, if simple person comes to you. So by doing this 5 minutes only, it requires HRV, and just depending upon that thing, you can modify your exercise prescription. So that's why, so all these things are important. These are the coming up, and if there is any doubt, please tell me, because not much time is there. I would love to talk, but the thing is, we have to wind up. So if you have any doubt, then please feel free to ask. Yeah, that's right. But thank you very much to attending, and thank you.